light on here I never noticed before. Oh, we're live! Hello, Facebook community. Thanks for following us. Thanks for joining us today. We're doing different things this month for mental health awareness, which is something very important to us. And we're trying to reach out of our comfort zone to break stigma. And so we appreciate you all being forgiving of us too, because we're new at this. We did start a little bit late, but hey, things happen, right? So I'm super excited that Miss Sharon Dunaway, one, has joined Face2Face Therapy, but two, that I also convinced her to do this with me because she has so much knowledge. How many years of social work?
Oh, wow. Oh, just 41.
Just 41. Just 41 years of experience as a clinical social worker. So she's got a lot of great information.
Yes. So, you want me to start?
Yes, let's do it.
Okay. So, I became a clinical social worker because I like to hear everybody's stories and kind of know how they're doing. And it just kind of flourished from that. I'm a board certified diplomat in clinical social work and got my license as an Arkansas advanced alcohol and drug counselor. So
when Sharon joined the Face2Face Therapy team and we sent her stuff for credentialing, which is a normal process, more than one person reached out to me and they said, "Oh my gosh, I've never seen anybody with so many certifications." It's true.
Hey, when you get in this habit of kind of like studying and...
Do you enjoy it? The studying part and learning?
I like the learning part.
Yeah.
Okay?
Yeah,
but the most of all, I just enjoy relationships and getting to know people.
Mm-hmm.
And, as a social worker, that's kind of what you do, okay?
Yeah, I think that's important for us to not forget.
Yes.
Yeah.
So, it's a challenge,
Mm-hmm.
to kind of find different techniques that works.
Mm-hmm.
And so that's kind of motivated me to move on.
Yeah, that makes sense. That's, I think, a little bit about what we're going to talk about today, because you have some really unique training in neurotherapies. Am I saying that correctly?
Yeah, right. Yeah, which is a focus on the brain, or how to utilize the brain for the healing aspect. So, so I'll go into how to build a resilient brain, okay? And I have to say, it kind of goes back to me growing up and where I went to church.
Mm-hmm.
You learn the value of our body, learn the value of our minds, and how precious that is.
Mm-hmm.
And then also I learned that when God loves, he loves with his whole being. Mm-hmm. And he wants us to kind of love him back using our minds, our bodies, and our souls. Mm-hmm. And so that's why I'm always attracted to relationships, mm-hmm. and I'm attracted to studying about the brain.
Mm-hmm. I think that's a really neat comparison, because actually when I think about the sciencey part of the brain and the word neurotherapy, I don't automatically think about religion and relationships. I think about neurons or something.
Right.
But I guess it all goes together.
But who created that wonderful brain that we have? Okay?
Yeah. Good point. Yeah.
And who created relationships?
Yeah.
And which leads up to the first point, okay? Mm-hmm. We're going to talk about 5 steps towards growing healthier, happier brains. Mm-hmm. And the number 1 is social connections. Mm. In a time when we're socially distancing, okay?
Yes, something that you have never seen before in your 41 years.
Right.
COVID.
That's right. And that we need to feel safe, be separated.
Yeah.
But have a really need to be socially connected, okay?
Okay.
And so we know that when we're socially isolated, our memory goes, and the loneliness.
So that's bad for the brain.
Yeah, okay. And so it can lead to cognitive decline, dementia, and even death, okay?
Oh, well.
So this connection is vital. It's so you can call it connection for protection.
I like that. It's the social connection
Yes.
to protect the healthy part of your brain.
Exactly.
To have a healthy brain.
Yes. Isn't that neat? Okay.
Yeah.
So we need to create relationships, get engaged, okay? Participate in any level of social activity that you're comfortable doing. So a tip that I have is that instead of doing like, okay, how are you doing? And we say, fine, and move on, and that's it. You know, get some interest in that person. So I like to ask, what's good in your life? Or how have you been blessed?
You know what? You've asked me that several times. What's good in your life? And I like that.
Because we can start on something positive.
Right.
You know?
Yeah. That's a good way to foster a relationship.
Yes.
Yeah.
Yeah. And show, I'm interested in you, kind of a thing.
Yeah.
So.
I like that tip.
And another tip is ask somebody for some recommendations or advice, okay? When you engage in somebody in problem solving, the brain it's like real active.
Okay.
Here, okay? And so the other thing is when you're doing face-to-face with somebody, all right? Look at their eyes.
Ooh.
We get a lot of benefits by seeing the whiteness of somebody's
Really?
eye. Yes, and looking at there's this automatic chemistry.
You're right. It does feel like a connection.
Exactly.
Which I think in therapy we know that, but even with me in my day-to-day life, I don't necessarily think about that. And mask or not mask, you can still connect with the eyes, right?
And that's the wonderful thing about it.
Yeah.
We got the mask on, but look for the eyes.
I like that.
And the both you and the individual will feel connected, and that's what we need right now.
And the brain needs that healthy connection.
Exactly.
I like it.
Okay.
Another good tip.
Yeah. Okay, so number 2 is eat for resilience. Okay.
Oh.
Yeah, we got to feed the body, all right? And it's all...
We should have pulled Lori in on this one.
and yes, and so we could probably do that.
We can do that another time.
But it's all about the kind of choices you make. Okay. And in regarding choices, we're talking about kind of reducing and not so much processed foods, because that can lead to inflammations, okay? And we want
the
more...
brain can get inflammation too, right?
Yes.
So that's where we're going with this. That makes sense, because I think about like the heart or other muscles, and we know processed food causes inflammation there, but I never thought about the brain.
We don't usually.
Yeah.
So that's yes.
Kind of important, the brain.
Yes. So, do the more whole foods, and get more of the balanced diet, like healthy carbs, healthy protein, fats on a regular basis, so the brain doesn't have to feel starved.
The brain needs healthy fuel.
Yes.
For sure. And I've learned that recently from my coach, Brick Walker. He'll be joining us later. And Lori Dather, about how my vehicle needs clean fuel, right?
Right.
Or my brain is a huge part of the vehicle. I guess it's the engine? Maybe?
Yes.
Yeah.
Yes.
Okay.
Yes, it's dealing with the whole system here. Okay. And so the healthy foods, okay? I want to just mention magnesium helps with chronic anxiety and worrisome thoughts, okay? Helps to counteract that. So food that has magnesium is rye, kelp, wheat germ, wheat bran, and nuts. Okay, and the nuts like cashew, Brazilian nuts, pecans, walnuts. Okay,
I knew that magnesium was very healthy. I didn't know necessarily the foods that contained a lot of magnesium. So that's good.
That's good.
That's another good tip.
Yeah. Omega-3 fatty acid, it stabilizes our mood, okay, and improve our cognitive and behavioral performance.
Okay.
Yes. And so omega-3 is kind of associated with fish oil and salmon, but it's also found in walnuts, soy, flaxseed, hemp seed, and other oils. Okay.
Yeah, and I know that sometimes it can be hard managing all that, and that's something you can totally talk to your therapist about, and they can help you with, or you can even set up an appointment with Miss Lori Dather.
That's right.
Who can help you with that too.
Yes. So, and then melatonin. Okay. Now, melatonin does, as we know, aid in sleep. Okay. Sleep is like our secret weapon, and it's free. Okay.
It's free.
It's free. All right, because during sleep, all right, it definitely is like pushing the reset button. The brain does certain tasks, okay, so that you can function the next morning. Okay. It also processed out certain debris, okay, that may kind of interfere and produce certain diseases. So it's like a cleaning out time.
Yeah, you kind of made me just think about the rare occasion when I actually turn off my computer and reset it, and then it does all these updates. So you're saying that kind of is what happens with the brain when you sleep?
Exactly.
Yeah. Okay.
Yeah. And it's rinsing out some of that waste and debris, and then it's also strengthening our memory. And how many of us need
sleep is so important, and we all take it for granted. And I'll say that's one of the biggest problems when people come into therapy that I see is the lack of sleep.
Exactly.
And they can actually start feeling a lot better,
right,
with good sleep hygiene.
Exactly.
Yeah.
And it doesn't take long to get that amount of sleep and feeling balanced again. Okay. So some tips. Okay. Caffeine does interfere with going to sleep. Okay. And so does certain screen of the technology.
Oh, like the blue lights. Yeah. Yeah.
And so it's a good idea anywhere from 30 to 60 minutes before you're going to sleep to try to avoid that blue light.
A tip with that I'll let you know that my 11-year-old showed me is that you can actually turn off the blue light or reduce the blue light on your phone. I know Sharon's idea is much healthier.
But hey, any movement helps.
Right,
okay?
yeah.
Okay? Yeah. But I still would recommend, hey, just read a couple of pages.
Yeah. In a book with pages?
Pages.
I like this. Yeah.
Yeah. And it just kind of gets those eyes a little bit heavy enough. We want to close them and, go into this nice, comfortable sleep. Okay? So that's always a good thing. And so sleep's number 4. Number 5, learn something new every day.
Every day?
That's the ideal. But I'm into learn something new. Okay?
Yeah.
All right? Because that really gets the brain stimulated.
Yeah. So maybe is that kind of linked to why some people do the puzzles and things? Because if you're doing, like, it doesn't mean like learning a whole technique of something new every day, right? But maybe a new recipe.
Yes.
Or
try something new.
Yeah. Okay. Yeah. Or a new puzzle or a new game.
Right. And it's not that you're supposed to be terrific at it.
Okay.
We have to take away the sense of failure. You're trying something, and it's like an exploratory of an experience. Okay, and this warns off anxiety and fear. All right. Yes. So having like an intentional activity, all right, is very good in trying to protect the brain. Okay. So I'm saying a tip: challenge yourself. You know, challenge yourself. See how far you can go. See how and discover. Did I like that? Or have an opinion? Not so much.
Right. Yeah.
Yeah.
But like you're saying, it's the process of the learning.
Yes.
Not necessarily that if you are a master artist or something.
Right. But a challenge may be sharing your knowledge, sharing your experience with a class, okay, or with others, okay.
Yeah.
And you know, doesn't mean they tried it, and if they want to have some tips on what happened to you, that'd be great. That'd be great.
I like that, and I think now with our connections, our social media is not always a good connection, but at least with the phones, we have access to learn new things on YouTube. Like, I was surprised. I had a friend who learned how to crochet such beautiful things, and she learned it all on YouTube.
See?
Yeah.
So virtual learning is just as acceptable. Okay.
Yeah. Okay.
And it's not about kind of what we did wrong. It's kind of that you're challenging.
It's working that brain.
Yeah, and you're trying to problem solve it, and you're trying to activate it and stimulate it.
Okay.
Okay?
I like it.
Okay. Okay. So, because of the times, I have to say that 50% of the people who recovered from the coronavirus is some people have various declines of brain function, okay? So some of the symptoms have been delirium, depression.
Is this brain fog that I keep hearing about? Is that something like that?
Yes.
Okay.
So let me tell you kind of some of the symptoms, and if you're having all this, don't get all alarmed. You know, there can be improvements. It could be like temporary little brain function dysfunctions, okay? Or headaches, like the inflammation we talked about earlier, or clogs, and the more severe consequences have been like meningitis and psychosis, okay? But again, we can build a resilient brain, like we talked about.
Right. That is always amazing. The brain is very resilient. I don't think even scientists still today know exactly how resilient the brain can be.
Exactly. Right? Exactly. And so being proactive and doing the 5 active things, okay, can build the resilience in the brain and relieve the brain fog, okay? But some of the things, besides nutrition and certain lifestyle changes, we need to consider that cigarette smoking and alcohol is counteractive to that
brain
process.
Function?
Yes, and it produces more brain foggy. Okay. Cigarettes contains neurotoxins. Okay, and
I never realized that. I think of cigarettes, I think of the lungs. I don't think about the damage to the brain.
Well, what happens is it constricts blood vessels.
Okay. Yeah.
And we need all the circulations of those blood vessels to the body and to the brain.
Okay, so if you've been thinking about quitting smoking, you might want to really, really consider that.
And,
it is not healthy for your brain.
Right. And also, I should let you know, I do help clients stop smoking.
Okay.
So, if I can help, let me know, and we can definitely
Do you use the neurotherapies? Or Okay. So something I didn't know. So hopefully we're getting some more mental health awareness out there for mental health.
Right.
The neurotherapies can be helpful for stopping smoking.
Right.
So if you're stuck in that cycle of having trouble quitting smoking, explore different options.
Definitely.
Yeah.
Or at least, reduce it
Mm-hmm.
to be a little bit more manageable.
Right.
Okay. And then the alcohol limits blood flow, and that again means that it can affect the mental acuity or our judgment, ability to judge and process. Okay, and so what we really want is to give the body a chance to keep that blood flowing and take away anything that's preventing it from that, so that the brain can have all the blood it wants.
No, that makes sense. I mean, once again, I'm glad we're talking about this and you're sharing this, because I don't routinely think. Everybody knows alcohol can cause problems with blood flow, blood clots. I've had people who've lost legs over the blood clots related to the blood flow problems from smoking and drinking.
Yeah.
But your brain needs all of that too.
Very much so. Yeah, it really does like all that positive that's of oxygen and blood flow and what the blood carries to the brain. So, yeah.
Awesome.
Isn't that awesome?
It is.
Yeah. We have a fantastic brain. We really do. And it is awesome. And so we just need to do maybe a few changes just to keep it more functioning on a long-term basis.
Right. We think often about our weight. That's been a big issue lately, especially post-COVID. Everybody gained a couple of pounds and trying to get back into their favorite pair of work pants or whatever. But I think if we focus on our brain, that kind of pulls it all in there to overall healthiness. Right.
And so, like you said, the brain's like the engine in the vehicle of the car.
Yes.
And so we want to keep the engine healthy.
Yes. Good fuel, good rest. Yeah. Updates.
Movement, exercise, and sleep, and learn something whenever you can.
Yeah.
Yeah.
So did you have is that all your tips for the brain?
Yes,
I didn't want to cut you off because
I understand.
It's a lot of information.
Very
helpful information. And
I hope so.
That's why we wanted to share it, and definitely this being a part of our Mental Health Awareness Month. Get the right information out there so that you can take care of your brain and know that you have options. A little small thank you for Sharon for doing this for me. I got her a green mental health awareness pin, which I think will match your jacket perfectly.
Oh, well, thank you. I'll put it next to my social work pin.
Yay! Yay! Thank you for doing this, Sharon. I know you put a lot of effort into it, and we're really, really grateful for all you do for us at Face2Face Therapy, because she's also the one that I lean on to and get information from and consult, but all that she does for her clients too, and helping us as a team. So thank you all for joining us. Make sure you follow us on Facebook, Instagram. Go check out our podcast. Hopefully we'll have a YouTube coming up soon. We'll see how that goes. And have an awesome day, and take care of your brain. Bye.
Bye.
Facebook just